Hi, my name is Dr. Brian Shiple. I am the Regenerative Medicine Director for First State Spine. I grew up in Southeast Florida and went to undergraduate at Western Connecticut State University and attended medical school at the New York College of Osteopathic Medicine in Long Island, New York. I did much of my medical training in Philadelphia and then did my residency training in family and community medicine at Christiana Care, which was called the Medical Center of Delaware then. I went on to complete a sports medicine fellowship at Penn State University Hospital in Hershey, PA. After completing my fellowship training, I was hired to develop one of the first sports medicine fellowship programs in the Philadelphia region at Crozier Keystone Health System in Springfield, Pennsylvania in 1994. I became the division chief of sports medicine for the healthcare system and ran their successful fellowship program for 13 years. Working in a large hospital organization, it quickly became clear to me that adding new and innovative treatment techniques was going to take a very long time to implement. As the field of regenerative medicine, now called orthobiologics, started to take hold around the country, I had to leave the academic world of medical education to train and start practicing the very early techniques of regenerative medicine. Many of the techniques and protocols used in regenerative medicine were developed by several of my colleagues and me, including the current regenerative medicine spine protocol I brought to First State Spine. After 13 years of academic sports medicine and orthopedics, I began my private practice in interventional orthopedic regenerative medicine in Springfield, Pennsylvania in 2008 with an ultrasound machine, a C-arm x-ray machine, a medical assistant, and a secretary. I developed expertise in not only x-ray guided regenerative spine procedures, but also helped develop many of the protocols in regenerative sports medicine using ultrasound guided techniques to help many peripheral joint conditions and injuries improve. My practice grew quickly as the word about regenerative medicine began to spread. Hines Ward and Troy Polamalu both boasted in the news how PRP had helped them heal quicker to be able to help their Pittsburgh Steelers win another Super Bowl. Stories like that caused high school to weekend warriors and some professional athletes to seek my regenerative medicine expertise to try to help their non-healing injuries, chronic degenerative conditions, and even failed surgeries. In those early days, we had entry-level regenerative medicine products, what we now call the first generation PRP. We now have the fourth generation PRP, which are stronger than earlier protocols, but have a much easier recovery for the patient than the first generation PRP preparations. Then in 2008 came bone marrow and the early techniques of how to harvest the bone marrow, as well as how to concentrate the cellular contents into as high a concentration as we could. Now we can concentrate your bone marrow 10 times higher than we could back then. With each new discovery, my colleagues and I would share our ideas and techniques at national meetings, travel to each other's offices around the country, and help train our colleagues both in the US and abroad. For over 10 years, I took off 2 months a year from my practice to help train other physicians around the world in the art and science of regenerative medicine.